Health and social welfare experts have urged the government to work more closely with the private sector to treat mental health patients. This follows a fatal stabbing attack that shocked the city. The Advisory Committee for Mental Health and the government have been commended for proposing several new measures to improve the city's psychiatric services. These include beefing up hospital manpower and prescribing new medication which has fewer side effects. Concerns rose after men who had mental problems fatally stabbed two women in a Diamond Hill shopping mall last week. Pediatrician Patrick Yip said the authorities have taken a positive step and called on the government to strengthen cooperation with the private and public sector.
Existing collaboration between the public and private interface actually has been there for quite a while, which is very effective. So in the coming months to years, one of the tasks is trying to enhance the involvement of the private psychiatric service in order to support more stable mental health illness patients in order to work together with the public service.
Yip's call was echoed by Szi Lai Shan, the Deputy Director of the Society for Community Organization, who was on the same radio show. She said mental health patients have to wait for months or even a year for treatment in public clinics. Szi urged the government to provide subsidies so that people can be treated earlier in private clinics. She also appealed to psychiatrists in the private sector to make their fees more affordable. Former Health Secretary Ko Wing-man, speaking on the Let's Talk program on iCable, suggested that mental health patients with milder conditions be treated by experienced nurses in specialized clinics. Ricky Zhu, who heads the Equal Opportunities Commission, called on the public not to discriminate against mental health patients, saying there's no direct correlation between violence and mental illness.